Right. Sophie, I think we can start. I don't know if she's there.
Hi.
Sophie, I think we can start.
Hello. Okay, great. Good evening, everyone. Good morning.
Hi.
It's morning.
Sophie, I think we can start.
Hello. In some places, I think there's an echo.
Okay.
Wait. Is it better now? Hi, everyone. Okay, yeah. Okay, great. All right, so welcome, everyone. It's great to be here. So we're just going to start with an opening prayer, and doing that would be Mena. So Mena, please go ahead and open us up.
Okay, good evening, everyone. Okay, let's pray. Father, in Jesus' name, thank you for bringing us here again. Thank you for the privilege to be here. We give you all the glory in Jesus' name. We ask that we're about to start, you start with us. We pray that you guide us through, that you give us the wisdom to be able to say the right words, that you teach us what you want us to hear this evening. And as we understand everything we are going to be hearing, that we shall put it to practice in Jesus' name. We thank you, Lord, because this meeting is already successful. For in Jesus' name we pray. Amen.
Amen. Amen. Amen. Amen. Thank you, everyone. Mhm.
You at
Because the patients will not even see the patient sitting down. But
Okay.
why
Probably have
I
to.
have even
that is the problem that the time manager has to.
I have even
All
gone
right. I
lately
made you a co-host, Sophie, so we can mute people.
when they answer your patient. Your
Okay.
patient
Thank you. Mena as well. I made you a co-host so you guys can mute. All right. Go ahead. Sophie.
All right, so welcome once again. It's really good to have you all here in your numbers. If you know anyone that hasn't, joined in yet, please do well to, send them a message. But really, thank you for taking the time to join us today for Living Vine Certification Board launch webinar. And this webinar is themed the future of certification in addiction care in Nigeria. Yeah, and it's really good to see the turnout, or the very strong turnout of professionals. We had almost 100 registrations for this, and we're really glad that you all took out the time. So over the course of this session, you would hear from our speakers, gain clarity on the role of certification in addiction prevention, treatment, recovery support, and of course we'll also have time for interaction. And I'm sure some of you have questions. I mean, during the course of registration, we had a section that just asked if you had concerns, and we've grouped those questions, similar questions, and so we'll have time later on to address them. So thank you. I encourage you to stay engaged throughout the session, and please feel free to use the chat to comment, engage, ask questions as we go along. Having said that, I'd like to get a feel of the room, and so quick we'll begin with a quick poll. Okay, so I'll put that up quickly. So yeah, you should see it on your screen in a bit. So yeah. So which describes your current role? I know we asked you this at the point of registration. I would still like to know. So yeah. Addiction treatment professional, mental health professional, public health slash NGO. Okay, yeah, please keep the votes coming in. Student or trainee, government or policy worker. Then we also have another question. Do you currently hold any professional certification related to addiction or mental health? And then the third one is, what do you think is the biggest challenge in addiction care in Nigeria today? Answering these questions would help give us some, perspective. Okay, yes, I'm loving the responses. Please keep them coming in. The poll will end shortly. So yeah. And if there's anyone that's not here yet, please do well to, send me a reminder to join in. Okay. All right. So based on the poll results, we have more of mental health professionals here, and then next up would be addiction treatment professionals, good numbers really, and then public health. We also have students slash trainee. That's good. And then, oh, okay, we have more people holding, professional certification related to addiction or mental health. I think that's very impressive. Okay, I think it just really shows our heart towards, supporting people mentally and just seeing that they are whole. And then the final question, what do you think is the biggest challenge in patient care in Nigeria today? Okay, stigma, for the most part, stigma and public awareness, and then limited trained professionals. All right, thank you, everyone. Thank you for participating in this poll. Thank you very much. And so, having said that, we'll just move on to the next thing. So I'm just going to stop the poll. Thank you for your engagement. We'll have some more come up later during the course of this webinar. All right, so thank you very much. So moving on, would like to just set the context, right? Just so we know what it is that we're talking about, how it concerns us, how it affects us. And so I have the privilege of handing over to our Executive Director of the Revised Education Board to just quickly talk about the current state of addiction care and certification gaps in Nigeria. So yeah, Mrs. Kumbi, over to you.
Hi, everyone. Thank you, everybody, for joining. I'm sorry, I have a little bit of a cold, so that I'm fighting. And so, but thank you, everybody. My name is Kumbi Oyedele, and I am the Executive Director of Living Vines Mental Health Foundation and also the Living Vines Certification Board. And so I really wanted to share the need for certification and the gaps. I would share my screen so everyone can see real quick and share a slide. I don't know if everybody can see my slide. Right? Good? Can you all see my slide? Okay. All right, great. So really, one of the things that we wanted to encounter, and I'm going to say that, I have had, my experience has been with mental health and substance use, but it's like as if there's a need. I found out that there has been a need for both, right? For us to bed, because there's a huge gap that we need to fill in Nigeria, right? So stepping out in faith, this was one of the things that came about from stepping out in faith. And we see that there's a lot of a crisis, right? Over 14 million people. I'm sure the statistics is not, we don't have enough. There's a lot of gap, right? We are still working on our statistics in Nigeria, but we see that over 14.3 million people have been affected with substance use, right? A lot of people, there's a lot of gap, there's a lot of, and now we also have our youth who are currently, using substances. We have a program in Living Vines that we do with kids where we go to schools and we see that there's a lot of those children are already using or have been exposed to using substances. And so because of the gap, we know that there's a need for an organization, a body that needs to come in and say, hey, how do we make sure that we are providing the care, we are providing the necessary care for the people, right? And we are also making sure that things are being verified. We are making sure that people are ethically treating the providing ethical services to client. And so here's, Living Vines Certification Board, right? And so one of the gaps that we notice is that, yes, there are different professional bodies, right? But it's really fragmented. And then also there's a lot of people that are doing work that are not really credentialed. They're just working because they have the passion. They haven't gone through the training of receiving the right credential to provide the care, right? And also there's also inconsistent gap and a very high relapse rate, which happens, in other places as well, not just in Nigeria. But there's the inconsistent care of quality care. And also, right, there's a lot of stigma and shame attached to that. And so one of the things we need to do is also on verified. How do people verify their staff? That the people that they are hiring have received the training and they have qualified staff to provide the services that we're doing. So one of the reasons why we're introducing Living Vines Mental Health Foundation. And one of the things we're also doing is making sure that we balance not just we are bringing, knowing that there's a problem, we are also, setting the standard for international care, right? Because we want to make sure that when people are providing the care, there is a standard. And not only is there a standard, we are also learning from international bodies and saying, hey, what are you doing? What is the research? How are we making sure that we are getting the quality information and we are now providing that same quality care in Nigeria? So Living Vines is the first our credentialing body that is recognized, that is has partnered with RCO and RC. RCO and RC is a international body, the body in the US, but they do international. They have other affiliations, or they have other bodies in different in other countries as well. And we are the first in Nigeria to be able to come in, partner with them, and be a body to actually, so that we can credential and certify for at least now for we're starting with 4 professional qualifications. And so we are building professional structure for addiction treatment. We are making sure that people go through, they have all the qualifications to be able to say, hey, I can, wherever, I mean, I guess I have my qualification in Nigeria, but I can work, and my qualification stands in the US, it stands in the UK. If I want to work, it stands in other countries that have the RC and RC body, or part of the body in their country. So that's very, very key, right? We're also bridging Nigerian practice with global excellence. That is key. We are making sure that you, as a credential body, can say to other places, like I said, that although I'm in Nigeria, I'm also practicing, or I am qualified like you are qualified in the US. I can work and I can do all those kind of things like you can do as well. So that's one of the things that we're bringing in. And they have, like I said, RC and RC has over 47 jurisdiction covered, and we are bringing the standard here. So I'm going to stop here because I don't know if anybody has any questions, but one of the things that we see, and I really wanted to share a personal story, so this makes it more personal. So when we started Living Vines, it was like we walked in and said, okay, this is what we saw, that there's a gap. And for me, it always been, how do we bridge the gap? How do we make sure that people are receiving the quality care, and they're also that the people that are receiving quality care are also getting trained? That's a very passion for me. And if everybody knows me, I know that I love to train people, and I like being trained, because I believe that education is the key. And education is the way forward to help people actually combat to build the gap for knowledge, and to be able to help people move from point A to point B. So hence the Living Vines Certification Board. I'll stop here and then hand it over to Sophie.
All right, thank you very much. I see our number has increased. Thank you for that presentation. We're coming to have you back towards the end of the session. But yeah, thank you everyone. Please keep doing the Lord's work by sharing the links with those that aren't here yet. All right, so quickly, I'm just going to do some bit of introduction. We have some of our board members. Before we have our first speakers, I would just like to say hello. We have Jamilia here, Jamilia Hand. We we have Mr. David Polaromi as well. We have Dr. Loretta O'Malley. She's our board president. And then we also have Ambassador Kenneth and more of them will join as we proceed. But yeah, we also have the credentialing team present here. We have Chukwuebuka, we have Mena, we have Ayomide. So please just say hello or wave or something. Yeah, just give us a reaction. And I'm also part of the team, humbly. So yeah. And we have our legal advisor, person of praise. I think she'll be here soon. But yes, thank you everyone. Having said that,
We also
having
have
our
Kenneth.
next speaker-
I don't think you saw Kenneth is here. Ento. Sorry.
Yeah, I mentioned, yeah, Ambassador Kenneth. Yeah, all right. Okay, thank you, everyone. So I'm going to read his introduction quickly, and then we'll just have him come up to share what he has. So Mr. David Falaromi is a Christian mental health and addiction professional with multidisciplinary training in economics, psychology, counseling, and youth development. He is a certified addiction counselor, public speaker, writer, and substance use prevention specialist trained by the United Nations Office on Drugs and Crime. Mr. David holds degrees from Covenant University and Brunel University, London, and a master's in applied social psychology. He serves as project director of the Live Free initiative and is an advocate for substance use prevention, recovery, drug policy reform, with a strong focus on adolescents and young adults. So, ladies and gentlemen, please let's make welcome Mr. David Falaromi as he speaks on professional standards and workforce challenges. So yeah, Mr. David, you have the floor.
Thank you very much, Sophie. Thank you. You're doing an excellent job. Well done. Thank you for all the reminders. Last week, I was here seated thinking it was that day. And I think I reached out to my boss, Madam Kumbi, and I said, what's going on? Where's everybody? And then Sophie came to the rescue to say it wasn't last week, it was this week. So good evening to everybody who is here. Thank you for being a part of what's happening. I think it's very timely. I think it's very important, especially for those of us who come from a place of passion, to see that what is being put out there is authentic, is evidence-based, and is professionally done. I want to say welcome to everybody. I mean, I can't call everybody's name here, but everybody who is a professional and his or her own right, thank you very much. So I'll go straight into what I have for today. So coming from a place of lived experience, right? And having been to rehabilitation in Nigeria and outside the country, I can tell that there's a wide gap between the way it's done in our home country, Nigeria, and what is obtainable outside. And so by the grace of God, when I came out of active addiction and I started helping people, walk through their sobriety journey, I knew I had to standardize whatever it is that I was doing. So I started taking courses here and there, the Colombo Drug Advisory Program, prevention, treatment, recovery, and all of that. But by the grace of God, a few years ago, about 3 years ago, when we wanted to set up a facility, right? And this was supposed to be a social reintegration facility, one of the very few in Nigeria. So what this means is people who go from rehabilitation or treatment have a halfway home where they can learn skills and properly reintegrate into the society. I started asking questions. I went back to those who have become oracles in the field. And I said, how can we go about this? And without mentioning names, it will shock you to find out that some people just said, David, just go and start. Once you have a place, just open it. Just go. I said, no, you can't just say go and start. There needs to be a standard. There's got to be a standard somewhere that we can work with. You just don't say go and start. I remember one particular person, a doctor, a psychiatrist. He said to me, don't worry. Just once you have a place, make it very comfortable, and then you can go ahead and start. So nobody actually had a proper template to offer me that is standardized that I can use in putting this all together. By the grace of God, I spoke to one of my mentors in the field, and another foremost psychiatrist who studied in the United States. And she said, okay, David, you need to do this, you need to do this, you need to do this. So she had worked as a resident consultant psychiatrist in quite a number of the existing rehabilitation facilities at that time. So I traveled down to where she was, had a sit down with her, and then we're able to develop a template that we used to set up the Live Free Renewal Center Social Reintegration Home, which by the grace of God is still operational, filled to capacity as we speak. Now, about 2 years after that, I felt, okay, there's the need to actually have the rehabilitation home, a faith-based rehabilitation center. Again, I started seeking opinions of people who have gone far ahead of me in the field. And I went to 29 facilities, 29 around the country, because I didn't want to go as others have gone. There's a lot of failure, as Madam Kumbi said. There's a lot of high rate of relapse. I mean, globally, yes, there is. But in Nigeria, particularly to us, if you are in the field, you will find out that what we are doing is recycling the people who are struggling with addiction. All they do is go from one facility to another. That's what's happening. And I said, I did not want that for myself. I wanted something that is standardized. I wanted to take whatever available certification that was obtainable at the time. So I started going from place to place, seeking the, having a sit down with the directors of quite a number of these facilities and finding out what are the certifications you need to set up a place like this. It's interesting to know that I went to some places, especially in Abuja. I went to places where people had zero knowledge on rehabilitation, treatment, or recovery of people who struggle with addiction. Some people just saw it as a business, had the money to establish it, opened a place, and started putting people in. I went to Kaduna State. While I was in Kaduna State, I went to a facility where every morning they flog people. That is treatment. Every morning they give you strokes of the cane, male, female, you to drink it. I mean, we all know that all of this is not evidence-based, especially those of us, those facilities that are set up as faith-based as well. A lot of them are getting it wrong because I'm a man of faith. My facility is a faith-based rehabilitation center. Yet we try to mix science and faith to produce the results that we're getting. You know, so I think it's very timely. That's what I was trying to say, that somebody stands up and says, look, we need to call what is happening to order. There needs to be a level of professionalism in what we're doing. There needs to be a level of certification before anybody can come into this field, because what we're doing is dealing with lives. So not every Tom, Dick, and Harry. I mean, we employ people, and then the last recruitment we did, you could see that there are people who had the passion to get into the field, but lacked relevant certifications. Yes, and so that's an issue. We have quite a number of young Gen Zs who are fresh out of school, psychology, this, that, is. And I said, this is good. I also did a master's in psychology. However, you need further certification in substance use disorder treatment, rehabilitation, etc., even in prevention field, before you can play a proper role in what it is that is going on. So the truth is that Nigeria stands at a crossroads, critical crossroads in the evolution of addiction care. We are at a point where we need to say enough is enough of quackery. You know, the rising rates of substance use, increasing complexity of the market, huge vulnerability, and other socio-economic pressures have exposed both the strengths and the deep gaps within the country's prevention, treatment, and recovery systems. Yes, we do have deep gaps. For those who have been opportune, privileged, or for whatever way they have experienced what is obtainable in developed countries, we will see that we are quite a way back in what we are doing. So what we are trying to do now, or what I'm trying to say in the next couple of minutes, because I'm sure my time will soon be up, is to examine professional standards and what the workplace challenges within Nigerian addiction care sector is. We're arguing that the future of effective addiction care depends on clear professional competencies, which is true. That's number one. Ethical practice, of course, supportive work environment, and a workforce that is protected, one, trained, and accountable. There needs to be accountability. Now, drawing from experience, global best practices, and the Nigerian context, what I want to say today is, I want to talk about the challenges, strategic directions for strengthening professional standards and addressing workplace ethics. We all know that addiction care is no longer a peripheral social service. Yes, it's a core public health and developmental issue in Nigeria, which we're talking about here, majorly before spread abroad. Substance use disorders intersect with unemployment, insecurity, mental health. Sophie said most of the people here are mental health practitioners, family breakdown, and crime. Over the last couple of years, by the grace of God, I've been doing this for about 8 years. There's been an increased visibility of treatment centers. It's everywhere. I mean, at the last count, I was counting almost 30 in Abuja alone. Faith-based rehabilitation programs, non-governmental initiatives, and of course, we have the government-led efforts, which I don't know if it's yielding much fruits. Now, while this expansion, for me, as somebody with passion because of my lived experience, while this expansion is encouraging, to say the least, it has also revealed inconsistencies in professional standards and significant workplace challenges for practitioners. I went to a school, for instance, carrying out drug abuse prevention practice, and then somebody, a student, 12 or 13 years old, comes up to me and says, sir, some other people came. They've come to our school before. Some other people came and they said that it is okay for us to smoke marijuana small. I said, who said that? Who says that to a child? Who says it's okay to? Who certified that person? Who is the person? I went somewhere else and I was talking about alcohol being a drug. And I jokingly say with the students, if you say alcohol is a drug, say aye, and everybody says aye. And I say, if you say it's not a drug, say nay. And some people say nay. I say, okay, you said nay, come out. Why do you say alcohol is not a drug? He said again, some people came here. I said, who are these people that came here and what did they say to you? And he said, alcohol has there's a part that is good for the heart. And I said, people can't keep telling children this. I said, according to the World Health Organization, there is no amount, there's no quantity of alcohol that is totally safe for human consumption. It's right there in the website, in WHO website. So you see, we need to standardize. There needs to be a body that standardizes through certification what we put out there. Because while there's an increase in a lot of organizations coming forward, it exposes the inconsistencies. Professional standards define how care is delivered. I believe we all agree with that. Now, while workplace conditions determine whether practitioners can sustain ethical, effective, and compassionate care without clear standards and healthy work environments, even the most well-intentioned programs risk causing harm, burning out staff, or losing public trust. The future of addiction care in Nigeria, therefore, depends on addressing both dimensions together. A lot of times, because of the number of people who have come either to fill their pockets for personal gains, or people who, out of emotions, out of, they just pushed to do it, which is a good thing, but lack the relevant certification. What can happen is that these interventions could become counterproductive. For those of us who have or who run treatment facilities, you would agree with me that certain people will come for treatment and you will find out that because of where they are coming from, they've made the person's situation worse than it ought to be. So something, not everybody that walks into my doors, I admit for treatment. Madam Kumbi will testify to that. I had a case just last week or thereabout, siblings. The mother called from US and said, okay, if it's not your place, David, they're not going anywhere. And I said, okay, let's see how we can assess the situation. And I said, we can't admit both of them under the same roof. Because I looked at the situation and I found out that there were certain other factors that was going to mitigate against their recovery if they were together. Do you know what the woman said to me? She said, but we're paying you for the service. I said, I know you're paying me for the service, but I'm not going to get the result I need if I put both of them, both siblings, a male and a female, not as if it's male and male or female and female, a male and a female. I said, so we have to pick one. She said, that's surprising. I said, why? She said, because every other person would have just gone for the money first. I said, well, money is good. I do love money, but I'm more interested in getting results. And if I put two of them together, then I'm not going to get the results that I want. So it's important that we understand that professionalism comes very important in our work. Professional standards refer to the agreed upon competencies, again, ethical principles, qualifications, and practices that guide addiction care professionals. They protect clients, practitioners, institutions, and the society at large. The core components, I'm almost done because I had a very short time. The core components of professional standards include 1, competence and training. Competence and training. Professionals must possess appropriate education, practical training. So not just theoretical, it must be practical. Supervised experience. When I was talking to Madam Pumbi, I think we had a meeting a while ago, and she was talking about how they're going to get the set of people who are going to get, and all of that. And we're trying to balance certification, qualification academically and experience. So for instance, you've had supervised experience for an extended period of time, then you should have an edge. You should be able to be qualified for certain certifications. Competence includes understanding substance use disorders as chronic relapsing health conditions, right? Familiarity with evidence-based interventions and the ability to work within multidisciplinary teams, very important. Number 2, ethical practice. Ethical practice. Ethics form the backbone of addiction care, be it prevention, rehabilitation, treatment, or recovery. I've seen a lot of people that because had a case, I was called to handle from a facility in Abuja. A lady who is supposed to be a care staff was dating a client the client has left. We call them clients. Some people call them patients, depending on the nomenclature, but we choose to call them clients. So the client had finished from 6 months inpatient rehab and then kept in touch with his care staff and then started dating, right? And then this client eventually relapsed. So the sister of the client reached out to me and said, look, what happened? My client relapsed and blah, blah, blah. And my brother relapsed and we paid millions. That's the heartbreaking thing. They always say we paid millions. And I said, okay, let me take up on the case. The moment I started talking with the young boy, it didn't take half an hour to find out where the problem came from. The lack of professionalism and, lack of ethics, ethical practice from the place of the care staff who started dating. And when I spoke with her, she still argued with me, saying, no, but he's no more a client now. He has gone, he has finished. I said, it's all rubbish. It's all, do you even understand the ethics of the profession you are in? You can't have a romantic relationship with a client or a past client. And that's as simple as ABC, and you didn't know that. And now that young guy had a relapse. Some people will argue that, well, it's maybe he was still going to relapse. However, this is what we can pin it to. You were dating an ex-client, which is totally wrong. So ethics form the backbone of addiction care. This includes respect for human dignity, informed consent, confidentiality, professional boundaries. Ethical standards protect the clients from exploitation, abuse, coercion, neglect, and so on. So we must, imbibe the ethics of addiction care practice. Now, we also look at the scope of practice. There must be clear role definitions. I was talking again, doing a training for an organization we helped to set up. And we found out that there is an issue. There's a gap with setting clear roles and responsibilities for practitioners or professionals in addiction care. They operate within their levels of training and authority, right? Counselors, psychologists, social workers, medical professionals, peer support workers, faith leaders, we all have valuable roles, but these roles must be clearly defined and coordinated. Very simple. Now let's quickly go to accountability and documentation. I'm going to have to stop here because the time I was giving is up, but let me just finish this. Accountability and documentation. Professional practice requires accurate record keeping. All of us should know that. Transparent decision-making and openness to supervision and review. Now, accountability builds credibility and enables quality improvement. So there must be accountability. I mentioned that earlier when we were speaking. Sometimes addiction care practitioners have become like mini gods because the people who come to us for help are almost, as it were, at our mercy. And some of us just feel like we are not accountable to anybody. That is wrong. You know, that is very wrong, and that shouldn't be. There must be proper accountability, record keeping, transparent decision making, and openness to supervision and review. So you can't be an omnipotent God because you're an addiction care professional and say nobody can check what you are doing. No. It's not done. I wish I had the time to tell quite a number of stories on how we had to check, you know, the acts of some senior psychiatrists in the field and say, no, you can't. I spoke to one of them recently. I said, you can't do this. You can't. And let me tell you that there's a chain of command in your line of work, and I will make sure that you get into trouble for what you're doing, until she was able to apologize and get her act right. And finally, we'll talk about continuous professional development. Addiction science evolves rapidly. I always tell people whenever I go to speak, for instance, I was teaching a group of young kids today on, no, not kids, I was teaching a group of parents on risk factors for substance use disorder. And I said to them, these risk factors are evolving. So what I'll have taught you 3 years ago is not what I'm teaching you now, because it's different. Yes, it's now different. Even the types of drug of choices we're finding nowadays is different, so it evolves. And because these things are evolving, as addiction care practitioners, our professional development must evolve. Ongoing learning is essential to keep practice aligned with current evidence and emerging trends, including new substances and treatment approaches. For lack of time, I'd have to stop here. I want to say thank you to Madam Kumbi for the opportunity to speak. I honestly do have quite a lot more to say, but my time is over. Thank you very much.
Thank you so much. Thank you so much, Dr. like I said, you are Dr. David to me. So thank you so much for coming and lending your voice. Really appreciate it. Over to you, Sophie.
Yeah. All right. I didn't want that session to stop, honestly. But I mean, we don't have enough time. I guess we'll probably bring you on board some other time just so we talk more. But thank you very much, sir. I think what stood out to me the most is how very important, ethics is in addiction care, how that forms the backbone of addiction care. So please, everyone, feel free to, share what stood out to you the most in the chat so that we can read through. I'm sure this has been a very, very insightful session. Before we bring up our next speaker, I have a quick quiz for us to take. I'd like you to indulge me once again. And so I'll put it up real quick and I will just, sorry. Oh, there's a question. Okay, I think Mr. David would be here. I think he'll be here for Q&A, so I will just address this. Thank you very much for asking. I have taken note of your question. Okay, I'll put up the poll or the quiz real quick. Okay, so myth or fact, you should see it on your screen now. We have just 5 questions. So hurry up. Let's see your answers. Just a quick knowledge check, really. So myth or fact, and it's around certification. So okay, thank you. Please keep the responses coming in. All right, thank you. Seeing your responses, so thank you very much for indulging me. Okay, so this poll would end in a minute. So please do want to respond if you haven't already. You guys are OGs. Okay. All right, so I'll just wait for a few more responses and then I'll end the poll. But thank you very much. Wait for, okay, yeah, keep your responses coming in. Okay, so thank you everyone. I'm just going to end the poll now and share quickly. So myth or fact, oh, we had 20 responses, so thank you. Let me quickly share the results. I mean, so for the first one, certification is only about passing an exam. Well, that's a myth because certification also includes, training, experience, ethics, supervision, and even continuing education or continued professional development, like Mr. David said. The next question, so yes, that's definitely a myth. The next one is anyone can provide addiction counseling if they have attended a field training. That's also a myth because training doesn't equal certified, professional competence. And then the next question, professional certification helps protect both clients and practitioners. Absolutely true. So yes, that's a fact. And certification is mainly about titles and status. Absolutely not. I mean, certification is about competence, about accountability, again, just like Mr. David said, and of course, standards. And the last one, internationally recognized certification can improve workforce credibility and funding opportunities. Yes, 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 absolutely. That's a fact. So yeah, thank you very, very much, everyone, for participating. Okay, on that note, our next speaker is ready for us, and I'll just read her bio quickly. So Dr. Loretta Ekanem Omale is a public health researcher and practitioner with over 15 years of experience across international and domestic programs. She currently serves as board president of Living Vine Certification Board and is a recovery support services manager at UIC School of Public Health, leading substance use prevention, recovery, and harm reduction initiatives through community outreach intervention projects. An adjunct faculty member at National Lewis University, she teaches community psychology and research methods. Dr. Ekanem has held senior research roles with IC and Save the Children International and publishes on addiction, overdose prevention, and health equity. So, ladies and gentlemen, please let's make welcome Dr. Loretta as she speaks to us on training versus certification, what truly builds
Yay,
competence.
Dr. Loretta, hey, and Dr. Kumbi. Okay, could you please give me access to share my screen? Thank you. If you could also make me a co-host so I can share my screen. And while she's doing that, I want to thank everyone that is joining us from everywhere today, all over the world. We are so glad you're here. We are happy that you're able to join us. So without much ado, I will, you see, I'm trying to open up my screen. Okay, great. Can everybody see me? And can you all see my screen? Can you see my
Yes,
screen?
I can.
Yes, we can.
Awesome, awesome, awesome. Okay, so I've been tasked with the responsibility of explaining. I will try not to do this as a teacher. Sophie, can you still see my face while I'm talking?
Yes, we can.
Okay, great. I will try as much as possible not to teach, but to just talk because Sophie says it's a talk. So I'll try to talk. And it's going to be very participatory. So if there's something you want to talk about, there's something that hit you, just drop a message, just drop a chat. So my name is Loretta, as Sophie has introduced, and Kumbi and Sophie has asked me to explain or give a talk about the difference between training and certification. What are they? What are the similarities, and what is it about it that we're talking about at Living Vine? And how does training versus certification build through competency? And so first, the question is, what is training? I'm sure a lot of us have had the opportunities to be trained, irrespective of where you are in your churches. You've gone through different skills acquisition. You've been trained for even things you just go and they say, okay, fine. Certificate of participation. You've trained on, people are farmers, you've been trained on GAP, good agricultural practices. People are medical personnel here. You've been trained on so many things, HIV, AIDS, mental health, all kinds of training. So training is just knowledge without verification. You've been trained. You've acquired knowledge. but that knowledge has not been put to test. So a lot of us have been trained. And so what are we going to say certification is? It's competency with accountability. So now you've been trained. And certification now says, for you to be competent, for you to follow a protocol, for you to apply what you have, that knowledge that you've acquired in a standardized form. That's where certification comes in, to improve competency and for you to be accountable. I'm going to be dissecting this very quickly. So the question is, what does Nigeria really need? Because that's where we're starting from. But I will say this, before I begin to dissect it, let's look at where we are. In Nigeria, the reality of Nigeria today is that, Kumbi has mentioned it, we have over 14.3 million now. This drug research or survey was conducted in 2019. And I've been telling them, please, it's time to conduct another one because this number compared to now should be higher because things have really happened. David has said a lot about how we now have leaders of psychiatrists, people who do not have the required knowledge and they don't have the level of quality competency and accountability, are opening all sort of recovery home, all sort of rehabilitation home without knowing exactly what protocol is required to ensure we have good quality service provision. And stigma and discrimination in Nigeria, trust me, against people who use drugs is very high. There is a growing demand. I've had meetings, I've had opportunities to talk to people. What is it called again? The NDLA opportunity. People are eager to provide support. There's an urgent need for community to support. People are saying, I want to help, I want to help. And that request, that demand is demanding that we begin to produce, we begin to have qualified addiction practitioner. And it's very urgent for regulation and certification, and that is what the Living Vine is doing. I just want to give us this context first. Now, we have a culture of stigma in Nigeria. And what does stigma does? People who use drug, because of the stigma associated, first in Nigeria, we see drug use as a moral failure rather than a health condition. Oh, this person is terrible. You know, all sort of things is being said about, you know, why people do what they do when it comes to substance use. And so that stigma is there because of also our cultural belief, our religious narratives and our judgments. It's rooted in community shame and social exclusion. And it has some criminal framing instead of health framing. If you use drug in Nigeria, you are a criminal. We do not see it as a health issue, and it's a big problem. So what stigma does to care? Why do people not, first of all, why do people not seek care? Because if we're saying certification, if we're saying we want to certify people to become professionals in addiction treatment and support, and we train the whole of the people that are interested and nobody's seeking care, then we've wasted our time. So people must seek for care. And why do people do not seek care? Is the stigma. Helpers lack compassion and skill. I am enthusiastic to help, but there is no compassion and there is no skill. Service remains hidden or informal. People are hiding to do things. I mean, David said a lot. I mean, he's doing a lot in his space. So he's been able to dissect that. People are providing services in a hidden way. Charging, I heard recently on Sunday that some people charge us 1.5 million a month just to take care of people in recovery. And I'm like, okay, is it now a business? You know, it's a business, but is that the intention? Where is the passion? No accountability for care. Nobody is regulating you. You do whatever you like. You give injections. You think it's like you are treating substance use as psychosis. You know, recovery treatment as personal failure. So all of these are the issues we are having. So having said those background, something is shifting. There's a growing number of people ready to support people who use drugs. And we are seeing an impressive and growing number of Nigerians who want to help. Social workers, nurses, counselors, community leaders. I have an NGO that works with community leaders. People in recovery also want to be peers that help other people. So they need standards. All of those people need to follow a protocol, a standard accountability process. So we all need, everybody I've mentioned and more, they all need certification. Rehabilitation and recovery home is growing everywhere. We don't want people treating people with no certification, no protocol, reduced knowledge, head knowledge, what I read on the internet. There is increased demand for training as well. Healthcare workers, community volunteers, NGOs seeking addiction demand outstreet available quality training. We also need to begin to think about peer support network. All those people, all those clusters of support, they need to be certified. They need to go through a process of standardization. So I want to define the terms quickly. So when you define the terms, training and certification are not the same. Training, certification are two different things, but there's an intersection. There is a relationship, but they are two different things. So training provides knowledge and skills, flexible duration and formats, variable quality and content. The content is there. You follow through. You get your certificate of attendance. Thank you for coming. That's all. No competence. One-off. It can be done without follow-up. But when we talk about certification, I'm trying to pull my screen close to myself. It validates competency with standard. It means for the training you've acquired, for the skills you've acquired, getting certification for that process, it validates that you are competent to carry out this role and responsibility, because we're dealing with human beings here. We're dealing with emotions here. We're dealing with people's psychology and spirituality here. So when you are certified, it means you have gone through rigorous process through highly trained facilitators or trainers, or co-certifiers as well. It requires assess performance. We need to assess your performance during the training and during the certification process. It defines a body of knowledge. There are ethics and there are conduct for accountability. You can't do anything and go scot-free. We have the HIPAA training here we conduct. If you are not certified for HIPAA in the United States, that's in fact one of the bases that you must have if you want to work in the substance use space. It's also renewable. It's tied to a continuous learning. Remember, training is one-off, but certification is continuous, and it protects both the clients and the practitioner. So what does competency really mean? There are 3 pillars of competency in addiction care. What you know, knowledge. You need to understand addiction signs. You need to understand the trauma-informed care that is part of what you're going to be doing. Pharmacological implications as well. What are the recovery models we have to follow? And I used to say it's not a one feed all. If that's I forgot. But so Nigeria have our own social cultural context. So we must adapt. We must adapt our certification and our trainings to the Nigerian social cultural concept. For example, we know that relapse is not a character flaw. It is a brain science and neuroplasticity that people must understand. You must also build skills, practical ability to screen. So when you say you are certified, it means you have the ability, you're competent, ability to screen, to assess, to do counseling, to refer linkages, to document, and to provide crisis intervention. You also have to understand that one of the key pillars of competency in addiction care is a commitment to dignity, non-judgmental, confidentiality, and cultural sensitivity. That means you're refusing to shame a client or breach their confidentiality to the family. In Nigeria, we like to talk a lot. Part of competency is confidentiality. And you need to be certified and go through rigorous procedures to ensure that you build that level of accountability in confidentiality. Okay, so for example, not all pieces of papers are equal. And in addiction care, the difference is life or death. Not everything is equal. You attend a 3-day workshop and so what? A community worker attends seminars, receives certificate of participation. They now offer counseling, but with no assessed competence, no ethics training, and no ongoing support. What is the risk? Clients are harmed. Confidentiality is breached. Reinforcement of stigma is in our faces. Let's look at scenario 2. You want to say, I am a AC and R certified. I'm AC and R certified through the Living Vine Certification Board. What does it mean? It means you are a certified addiction professional who has passed written and oral exams and tests and assessments. You have met supervised practice hours. You've agreed to an ethic code, and you've completed continuing education for the duration of time we'll be working with you. What is the outcome of being certified? It means you're able to provide quality care. You're able to also protect client rights, and you are accountable in your practice. Very quickly, the role of Living Vine Certification Board. We are setting the standard. This is the first in Nigeria. So what are we saying that Living Vine's Certification Board will do? We are currently partnering with ICRC. It's a global standard. Kumbi talked about it. And we want to provide a Nigerian or African textualized certification pathway. We want to establish a code of ethics and professional conduct. We want to create defined competency for addiction professionals. We want to support continuous learning and professional renewal opportunity. And we want to ensure that everyone that is certified through the Living Vine Certification Board is a certified professional in policy and can get a job anywhere. So why are we affiliated to ICRC? ICRC has been able to, provide credentials. It's currently providing credentials to over 80 plus countries around the world. And credentialed professionals globally are over 60,000 plus. It is recognized by governments and employers and insurance all over the world. It is international. And it is a very rigorous certification platform because there are exam-based competency assessment. It is rigorous. You have to go through the process. So what are the certification drive culture change? I call it 1 to 5. You have to be aware. Training rate, you have to, your training will increase your awareness about addiction as a health issue. Your knowledge will improve. You have a structured learning that is built on evidence, and that evidence, you understand it. For competency, assess skills, ensure safe, effective practice. Ethics, a code of conduct protects people who use drugs. It protects their dignity, their rights, and everything that they need to be. It also helps them to advocate. So when practitioners are certified, they become great agents of cultural transformation and not just care providers. I'm rounding up now. So what are the barriers and how can we overcome them? Real challenge Nigerian face right now, and what LVCB is doing is, more low, I can't afford it. So what Living Vine is doing for this certification is that we are developing affordable phase payments and scholarship pathway for Nigerian professionals. When we're talking in the board about the costs we'll be asking people to pay for this certification, we were very deliberate to ensure that people will be able to afford this. So if you're thinking about, how can I afford this? I really want to do this. I'm really interested. We are working hard to make sure that it is affordable. So get your mind to rest. You can afford this. It's not going to be something, it's international. It's standardized all over the world. It's acceptable by all governments of the world. So we want everybody to be a part of this so you can provide support in Nigeria. There is no formal pathway in Nigeria. So we are trying to establish the first IC and RC affiliated credentialing body in Nigeria. And we have started. We have started with this training, with this webinar. Tell people you know that this is happening. We have started now. Who will recognize my certification? Emi Oshe nurse, me Oshe doctor, me Oshe psychiatrist. We are trying to apply what's happening in the West to what's happening here. People are certified for different kind of things. We're just saying that IC and RC, their credentials they are accepted anyway. It means you can actually add this to your resume and get a job in the space of in the area and the space of addiction. I've been speaking with a lot of people in Nigeria about this. I'm like, Loretta, you know what? We need this. I'm going to get my staff to be part of this to get certified. So we're looking that in the nearest future, 1 or 2 years, if you don't have the certification, you might be unable, to really get that dream job in addiction in Nigeria and in Africa that you want. I'm just a volunteer, not a professional. Certification pathway exists for peer recovery coaches, community workers, and frontline workers as well. I'm sure that Sophie is going to cut me up very soon. So for the Living Vine certification, what is the pathway? What is the journey from training to certified professionals? 1, we are going to check your eligibility. You have to meet some educational and experience requirements. You are going to be sending in your application. You are going to be doing a pre-exam training. There's going to be an examination. Then there's going to be credentialing. And over the time, there will be renewal as well. So the next slide is why now, why Nigeria? We know all of this. We need to, it has to be Nigerian-led. So most of us in the board and I'll be doing this work, most of us, 70% of us are Nigerians. So we want to protect everybody, we want to ensure that there is professionalism in our field. What are your next steps? Your next step starts today. Certification is not a destination, no, it's a commitment to the people you serve. So we want you to explore what we're doing at Living Vine, join the Living Vine community, share the webinar with your friends, commit to continuous education. There's so much to say in a short while, but I want to thank you and say that the future of addiction in Nigeria depends on certified, passionate, compassionate, culturally grounded professionals. Yours truly, Loretta Ekane-Omale. Thank you for the time to share.
Thank you very much, Dr. Loretta. I absolutely loved the session. It was so insightful. All right. Woo, okay, that was a lot to unpack. So thank you. Thank you very much. Before we move forward, we had a couple of questions, and so we'll just quickly address them while we still have you and Mr. David on board. So the first question that was asked, I'll just read it. And yeah, so good evening. Okay, this is from Samuel. He's asking, so in professional conduct, so in terms of professional conduct, so even after therapy or after rehabilitation, say for like 3 years or more, should there still be no form of relationships? I think this still boils down to the ethics conversation. So I think this question is to you, Mr. David. Yeah.
Thank you.
So is there a particular year gap?
No, there's no year gap. Once you have served as a therapist to a client, there's no point. He remains an ex-client. You cannot enter into a romantic relationship or otherwise with that client. Anything outside the professionalism guidelines, you cannot. It's absolutely, we talked about addiction. It's a chronic relapsing brain disorder, right? So who is to tell you that at some point when you are romantically involved with him after so many years, there wouldn't be a lapse or a reoccurrence? So what do you now do? You're not able to help. So no, there's no point in time you can have a relationship with a previous client. Thank you.
All right. Thank you very much, sir. I'll move on to the next one. Okay. So still from Samuel, and I think I'm just going to merge this with one other question that was asked. So he's asking if there will be an online class for those that are not close by. And then someone from northern Nigeria has shared his or her concern about the issue of addiction going on there. And he'd like to know if there are any plans for training office in the northern part of Nigeria. Yeah.
Is that for me, Sophie, or for David?
I think any one of you can answer. It wasn't addressed.
I will just jump to the online thing. The training, the certification procedure is online. We know you all can't come to the US. And that is why it's a body that serves over 80 plus countries across the world. So I will say to you, all you need to commit to right now is get a good Wi-Fi, get a good internet connection, and you are on the go. And the second question is what again?
The
Sophie.
North. Is it coming to the north or something? I think that's what it is.
Is this program coming to the north? So this is that correct, Sophie? Is the certification coming to the north? Yes. So this is for every Nigerian that is interested in supporting the substance use space. Like I mentioned in my presentation, nurses, doctors, community leaders, volunteers, peer recovery coaches, everyone is very much welcome. Like I said, it's going to be a rigorous process. We're going to take exams, pre-exams, pre-qualification, but rest assured that we're going to ensure that it's as accessible and application friendly as possible. And having someone in northern Nigeria is also a plus. So wherever you are coming from, all over Nigeria, the south, the east, the north, the west, the middle belt, south side, please spread the good news. So it's coming everywhere. You'll be our ambassador there. You'll be our focal person there. I'm hoping that the first group of people that will get certification will ultimately be our ambassadors going forward. Could be something we should talk about as well.
Yeah. All right. Thank
So,
you very
okay,
much,
I think
Dr.
people are
Loretta.
putting in.
And the
First
next
of-
question here.
Sorry, let me clarify this. And I wanted to share with regards to dating. In regards to dating a past client, APA ethical framework is 2 years and ACA framework is 5 years. That's true. While people, organizations, or ethical, yes, they give that. However, it's just advisable not to do that, right? Even within, they would say after 2 years you can, or 5 years, but that it's very advisable. Initially it used to be 10 years. They'll say after 10 years you can start dating a former client, but it's just very advisable not to even try it. It doesn't, there's so many complications, there's so many other issues that can happen. I recently attended an ethical training, and even after all of these things, there was still complications, and people will say yes after 5 years but it's not advice to do that regardless of what framework that they give. Yes. So
All right. Thank you for addressing that. The next question here. Okay, so will the certification pathway cover mental health professionals who have hitherto not worked in substance abuse field but might be interested in doing so? And then a follow-up question to that is, just like in other mental health specializations, there should be opportunities for internships and supervised hours. How will Living Vines address this?
So we're launching today. We're launching. So one of the ways that we'd like to address that is to, first of all, partner with organizations, right? That are, because that are providing services on ground, so that one of the things we can do is, once you've started your application with us, we can say, hey, this person has maybe 6 months of training or internship, but they require 6 more months. Can we please work with us, knowing that this person, after they're done, will be certified? Of course, because they know that we will provide the certification. They know that we will go through the rigorous process, and they're getting a good person, a good intern. So we would partner with organizations that we can refer to, and then you can get your certification after you're done. So that's the workforce development kind of thing that we're hoping to do. So that's the workforce development aspect that we're hoping to planning towards, going towards. Yeah.
Yes. I think that's what Kumbi, you talked about internship, and we are going to be there's something I forgot to say that, and David mentioned it, and I'm going to say it here without any apologies. Substance use work, right? is not a psychiatrist or a psychiatrist doctor's work or responsibility. I know this is being recorded, and I mean, I stand to be corrected as well. Substance use recovery process is a rigorous process that is beyond just injecting people and giving them medicines.
Except the psychiatrist has an addiction.
Exactly. Exactly. Thank you, Kumbi. It's a behavioral challenge that we need to deal from the root. So being certified is key to understand how to approach people. So yes, internship is something we are also interested in. We want to have our people, after going through this rigorous process, to go, get some hands-on experiences in a lot of organizations that we'll be partnering with. Yes.
Okay, so many questions. Oh my goodness, I like that. It makes it easy, so I don't have to go through my second slide. So I think, can you read? There was somebody that said something. Oh my
Kumbi,
goodness.
there is one you should answer. She said, will the certification pathway cover mental health professionals? I think you should answer that.
Yes, it will
Who have
cover.
either told yes.
It would cover. Sorry, can I read the question again? Could you repeat it? I'm sorry. With
Will
certification.
the certification pathway cover mental health professionals who have either not work in substance abuse field, but might be interested in doing that? You are the mental health specialist.
So for that case, what we would need to do is there still need to be a training, because for you to be certified in addiction care, of course, we are also going to bring the mental health piece of things into this, right? As we grow, right? There's going to be a mental health component, because there's a mental health component to addiction. However, you need to go and do a training. Right, to have an internship or a training. So if you've had training and they are different. So I'm assuming this is somebody that wants to be a CADC, that's a counselor.
CADC, yes.
Yes. So you would have to go and do some training. There's a training component that you need to have to be able to get that addiction part taken care of, and then from there. But this is one thing we were going to talk about. So if you have a master's degree in psychology, right? You have to have maybe a year experience in addiction care. So we need that, right? So, but the lesser, like for example, master's level is 1 year. If you have bachelor level in psychology, it's 2 years. So everything is in our website. We're going to put all those things in our website. But the more credential or the more education you have when it comes to master level or stuff like that, the less experience, like the less time you have to spend in getting practicum. That's what it is, really. But we still have to have that practicum experience in addiction. So that's very important. Yes.
Another question said, do I need a medical background to be a part of the training? No, you do not. You did not.
In fact, the way that we did it is so that you can even have from your SSC, really, you can start. But because there are some people that have SSC and they're done, but that experience is required, but they need more extensive experience, right, to be able to qualify to get that thing. So you don't have to have, if you don't even have you don't have to have a medical background, no.
The next one says, will there be opportunity for an international remote internship? Well, I will respond to this because, so we are not promising an international remote internship, but once you come, you join us, you get certificate, we are not assuring you, but we can work things around. We are Nigerians and we are standardized people, and we can look for opportunities for you, but we are not promising you that. Second question, Kumi, can this certification serve as a substitute for Columbus Plan certification?
I think I want Dr. David to answer this question.
Yes, I was going to say you should answer that.
Substitute, when you say substitute, we're not here to compete with anybody. We're not competing with Colombo Drug Advisory Program. I've done quite a number of their certifications and all of that. So we're just offering a different angle. That's what we're saying. So it's Mercedes and Audi, right? So feel free to pick what you want depending on what it is that you actually want. It's not a substitute. It's just an option. Yeah, it's an
Yes,
option.
I think that word option. The last question, interestingly, is from my brother, my blood brother. He's here. I hail you, sir. He's a major in the Nigerian army, so I greet you. This is his question. He said, I reckon addiction treatment is becoming very broad, considering the various kind of social stimulus people are exposed to. Besides drugs, there is gambling and pornographic addiction. Do this certification cover this other kind of addiction? Or what globally standardized provision are made for them? Kumbi or David, over to you.
I want to answer that question. We're starting with addiction, but like I said, in the next couple of months or even a year, we're trying to bring their gambling into that. So I know someone that's, we have, because it covers, there's a certification for, there's a training and a certification for gambling, specifically for gambling. Upon addiction, I am not, I'm still learning about, I don't know. But for gambling, we definitely want to bring that into because of the prevalence of it. So we're looking into that in the next, probably in the next in a month or so, in a year, I would say. We'll be able to add that into one of the things we want to do.
Okay, Kumbi, this is for you. What's the duration of the program?
Duration of the program. When you need program, what do you mean by the
certification process? Yes, for
so you start okay. So you start with it depends. If you have all your things dots in a row, you already have all your education piece. You are already trained. You've done your practicum. Then you just go in and do an application. It should take at least maybe a month because we are our certified, our specialists, certification specialists have to go through all your documents to make sure everything is right. But I would say give us at least a month to go through all of that. So one thing is that because we're just launching, we are launching at something called a legacy period. And like Dr. Loretta said, the first few people that are going to be certified are going to be our ambassadors. So RCNRC has done something great where they say, see, you guys are just launching in Nigeria. We want to give you the opportunity for people to bypass the exam, which is a fee, right? You have to pay for exam, but we will let you go through this. They will do the certification, but they will not pay for exam. And so that's the legacy period. And so we want to do that. So we are starting that in March. Well,
next month, late next month.
Okay. So we want to start that so that we can give people the opportunity to get all of the documents that they need, because we have about 30 days to make sure that we certify people in the legacy period. So we want to do that. So the first maybe 10, 20 people that get certified, we're going to have a legacy period where they pass the examination. And it's like we're giving you without examination. So RCRC is giving us the opportunity to do that because we just launched. So that's an opportunity.
Mm-hmm. The other one says master's. I'll take this. My master's degree is in public health. I have a master's in public health. So yes, I think you wouldn't have to stress because it's basically what you already know, but you're just getting certified, for what you already know, but in the field of substance use, recovery and addiction treatment as well. I have first, yes, Kumbi, shoot.
I have a question. So I think we're talking about counselors here, but we have four different professions. So we have counselors, we have prevention specialists. So I'm assuming that somebody in public health would definitely want to go into the prevention aspect of things. So if you want to go into prevention, there is prevention. If you want to go into counseling, you can go into the counseling addiction. If you want to go into a peer recovery. Yes. So a peer recovery is somebody that have lived experience and they want to use their lived experience to help other people, right? There is that. We have the peer recovery, and then we have a supervisory certification, meaning that you have been working this road for the past maybe 10 years and you now want to you want to supervise other people, and we really do need supervisors, because those are the people that will be like gateway and say, hey, that will train other people that are oncoming. So we have the supervisory track as well. So there are 4 different, for now, there are many other things that are coming, but for now, those are the 4 things we're starting off with.
For all the sociology with 6 years experience in medical work and the masters in social work, I think it's going to be an easy breeze for you. Very easy breeze. You just need to specify, like Kumbi has explained, do you want to do peer recovery? Do you want to do prevention? Do you want to do counseling? And Kumbi, you forgot to talk about the first aid mental health program that you run. So you may want to say that, especially for those folks who are thinking about mental health intercession and substance use. Probably want to talk about that and tell them the next time you'll be having that webinar or that training.
We do mental health. I'll talk about that later. Like, that's even a separate mental health thing. But yes, we definitely want to include the mental health piece into people that are having addiction and need that. So yes, but sorry, going back to somebody that has a 6-year experience in medical social work, I think is great. But like, do you have the documented experience? So that's another thing, right? People say I have, but if we need that somebody that has been able to sign off and say, hey, you have this experience. Once we have that helps, right? Because that's what gives us the document to say, yes, the certificate, to verify that you have those experience. So once we are able to verify all of those things, I think it helps. It will definitely make fast track things and make things quicker.
So I really think for everyone, I think that's aside from woman, I think for everyone, I will strongly recommend that you put your documentations together as evidence, because I know that in Nigeria, with all due respect to all of us who are mostly Nigerians here, documentation is a big challenge for us. We can just wake up and say we want to do this, do that. But with this international body, it is not business as we know as usual back home. You need to show evidence that, you're qualified to apply and to be a certified professional in this regard. Ebro says, yes, I currently work in a government facility. That makes it awesome. So you have documentations to show that you've met the criteria. And yes, we love to have you join our first cohort starting March, April.
So one of the things,
yes.
Sorry.
Go ahead, Kumi. Go ahead.
One of the things I wanted to share, I think one of the things that we bring, because they'll be like, what's the difference? What makes it? One of the things that kind of separates us or makes us is the reciprocity. And I wanted to discuss this. So reciprocity is the ability for you to say, hey, I am certified as Living Vines, addiction through Living Vines in Nigeria. But you now you want to work in another country that has RC and RC, right, as their board member. You can now go in through us and say, hey, I want to kind of get clients in Canada. I know they have something in Canada. And I want to work there. I want to be certified. I want to get their own credential in Canada. So what do I do? So we go through the process. RC and RC is the middleman that helps you when you're certified here, and then goes through the process of saying, Canada, there's somebody in Nigeria that is certified, and Living Vines has credentialed them and they are good. But they want to come. What are some things that you need in Canada? And Canada will say, yes, this set of some things, this. And from there, you pay a fee and you can get your license both in Nigeria and in Canada, meaning that you have the ability to actually even see client in Canada, even though, do you understand? So, but every jurisdiction has their own, what's it called? Their
protocols,
requirements. Good requirements. However, but one thing that helps us is the reciprocity, because you have the opportunity to say that I am certified in Nigeria, but I can actually work in, be licensed in another country. So I think that's for me, that's a big deal, right? But then that's the reason why the standards have to be very good, right? Because another person can say, what are the things, what are the qualifications? We have to make sure that your qualification matter in Nigeria and gives you access to be able to say, hey, a good standing in another country. So that's why those things, there's a little bit of a rigorous approach to this, right?
Before I hand over to Sophie, before she kicks me and Kumbi out of this place, we apologize. You're our boss. David, this is for you. Seeing that addiction management is a profitable venture in developed countries, similar prospects are there in Nigeria because of addiction prevalence. Are there long-term goals to provide certifications for organizations or rehab centers set up to provide addiction management services? David, this is for you. Is David still there? I mean, Nigerian Wi-Fi has happened to him. Kumbi, if David is not there, you can please jump in. So what are the long-term goals to provide certification for organizations?
Well, I think for us in Living Vines, it will be for us to work with their staff, right? Because I know that, for you to have a program, rehab centers and all of that in Nigeria, you have to go through the government, right, to set up all those things. So what we want to do is make sure that the staff that are there are qualified and that constantly they're training, they get qualified to provide the care. So that's important. In fact, what we want to do is actually work with the government to say, hey, right, we want to be able to have a standard. We want the standard to be across the board so that people can the professionals can get credentials, not just working in government, but they can also, like insurance, right? We want to work with insurance and say, because you are certified in this certain way, that gives us the ability to even bill more, to pay, to be able to bill more, because that's how it works in the US, where the insurance kind of says you have to be certified certainly to be able to bill a certain amount of billable services. So that's where we are going. As in, there's such a future advancement, and so that's the plan. That's the goal.
Okay, handing over to my boss, Sophia, but my last word will say, we're working with the government of Nigeria, and we have been officially approved to do this in Nigeria. So we are recognized in Nigeria. You need to know that. And this is the first in Nigeria, first ever. And we're trusting that it will get to a point in Nigeria that if you go to any recovery home or rehab and you do not have a certified person from Living Vine board, I would ask you to be careful how you access that service, because that's to show that they don't have I mean, I'm not saying Living Vines, but want to make it a household name. Yes, certification from other places, but one thing that is unique about Living Vine is everything we're doing is adapted, is contextualized to our culture, to our belief system, and our idiosyncrasies. So thank you, Sophie. Over to you, and thank you for giving us plenty time to talk.
All right. Thank you very much. And thank you to everyone that asked. Thank you, speakers. Thank you for your sessions. They were so insightful, and for taking the time to answer the questions that everyone had. Mrs. Kumbi, I'd like to find out if you're still interested in sharing your screen. I mean, we're almost wrapping up, but I mean, I think the questions have covered most of what you would have.
Yes, I think the questions,
yeah.
I think I think we're good. I really do. If anybody has any questions, Chris, can we post the Living Vines website on the chat, so that, and then also our info, our contact and info, so that we can, if anybody has any questions, we can go from there, please. And also we hope to get sending emails out to people. If you've registered for this training webinar, we'll be sending emails out and letting people know what the next steps are. But please feel free to share, to connect with us as we start this process. We want people to start preparing to send in their documents and all of that, so that we can start working people towards that. How do we register?
How do we register, Kumbi? And Kumbi, what's the number of the first cohort?
We're hoping to, if we can get 20 people, that would be fantastic. More than that, but at this point in time, I am hoping to get 100. That's my desire, because the more we get, the more people that can be an ambassador for us in different part of the country, so that people can register. So that will be like the first 100 people that would be certified without getting examination. That's a fantastic deal. So please, please, please make sure that we utilize this period, because after that, after we
You have
close
to
up,
pay for your exams.
you have to pay for the exam.
And it's
Exactly.
a lot of money.
Yeah, so we want people to utilize that as much as possible. Mhm. The amount
Right.
go, we will please, it's on our website. We definitely is on our website. If you go to our website, you find out more, and then also connect with us. We'll let you know. It's
affordable. It's your subscription to, what do they call that in Nigeria? Subscription to those TVs you watch, and subscription to your data. It's something you can afford. Trust me.
Mhm. Does anybody have any other questions? So really dealing with the cold.
Okay, I think that's all for now. So I just dropped the website link in the chat, and I'll be sure to send follow-up emails with respect to certification. So please be on the lookout for that. And yes, we have a WhatsApp community. The link was shared at the point of registration, but if you don't have it already, that would also be sent again. So thank you once again for being part of this launch. We look forward to staying connected with you, even as we continue to set the standards and restore many more lives. So thank you, everyone. Thank you for your time. Have a wonderful rest of the week. Bye.
To stop recording. Oh, yeah, my goodness. I didn't even talk about how we forgot.
We are still
I was
here.
going to talk about our ethical. Yeah, sorry. How people can send in their ethical complaints, if anything, but it's on the website anyway.
Yeah, it's on the website. Kumi, do you think we should put this presentation on the website for people to go through?
Yes, we recorded it, so
Okay.
we would.
Sophia, I'm going to forward my slides to you. So
I love your slide. Oh my goodness.
Thank you. I know. I love my slides too, you know.
I need to come and teach me how you did your slide, though. Please. Oh my goodness. It's so colorful. It's so nice.
Thank you, everyone. We love you. Thank you for staying. We had over 40 people, and most of them stayed. So we are really grateful. We're grateful.
Thank you, everyone. Please, how much for registration? Oh my goodness.
All right, bye.
Thank you.
Make me know.
We have people that want to go. We are finished though.
Thank you, everyone. Thank
you. Dalo, bye. We love you. Thank you. Now good day.
Thank you, everyone.
Dalo, no. Thank you, everyone. We really appreciate it. God bless you. Please register. Please go to the website. Please register. And let's do this together. Let's save the future of addiction care in Nigeria.
Yeah, we need to do the mental health piece of things.
Yes.
Certification.
I think that's the first aid mental health thing I did with you.
Yeah, but the first aid mental health, it's a lot.
Story there, but I will talk about that one later.
Yes.
Kenneth, thank you so much. Nelson, I see you. Thank you. I see my husband here as well. He's been here. Thank you, my love. I see my niece here. Chukwe Bukainok, Ayomide, we thank you. Auntie Faith, I see my mom here. Auntie Faith, thank you.
Your whole family is there.
I'm telling you, my whole family came. Thank you, Jama. Isia Kabalogu, thank you. Noni, thank you. Praise. No, that one is not take out. Sophia, don't confuse me. Tolu Asiri, we thank you so much. We really appreciate it.
Kindly send. Okay, well, everybody's kindly send. I thought we put it in registration. Please, can you put it on the group? The registration thing.
She did. She put
the website link. Yeah, I put it in the chat, but it was probably missed, so I would share.
All right, so Doctor, we'll see you again tonight. Oh, you are talking again tonight.
Okay.
I'll book you back to back. I must give you your husband. I hope your husband is like, hey, the way you my wife, eh?
He will say, is it not you and your sister Kumbi again? I like it. It's also, let's go and save the world. All right, I have to go. Thank you, Sophia and the team. You guys did excellent. This is good. And well done. I like the poll. That was good. Whatever you're doing, you need to teach me. You need to teach me how to do that. All right, I have to go.